guys, I'm Shanna. I'm a third year medical student at UBC and I make a bunch of videos on, helping pre-meds, but I've been lately doing a lot of vlogs while I've been having some, a lot of adventures during clerkship, which is our third year of medical school, which we rotate through different things in the hospitals and the clinics. And so this vlog, I'm going to be showing you guys my family medicine rotation. So at UBC we go off to a rural community, and so for my month, mine's one of the ones on the island, and we spent a month there and we really immerse ourselves into the role of a family doctor, which in the rural area means you do kind of everything. You kind of are the emergency doctor of the island, you are the regular family doctor, you take care of everyone's chronic health care needs, and then when someone comes in with they cut themselves, you're also the surgeon at the moment, and it's kind of interesting in that way. And I've I've always lived in the city, so I'm not super familiar with rural life, but so it's also a learning opportunity for me to just experience that and soak in. I think there's a lot for us to learn. Like there's aspects of different lifestyles, and also understanding. I will have patients that come from who live in a variety of settings, so just having a bit of understanding. For example, just even something as simple as realizing if I'm in Vancouver and someone has to come in from Main Island, they have to really plan those ferries right. So I think, I don't want to put my patient who's coming in from Main Island at the 7 a.m. appointment, because how are they going to get there if the ferry is not working? So but also not putting it too late, because they have to make sure they catch a ferry to go back home. So really thinking about these small things like that, or just being considerate. If I can't refer them to services because there is no physiotherapy, for example, on the island. There is no OT on the island. So really just thinking about what kind of services are available in the community, and it's been helpful for me in that way. And hopefully just enjoying the island life and showing you guys that. And everyone's really nice on the island, and there's a lot to enjoy. Bye. This is my home for the month. This is the front yard. There's the view. Bunk bed. A whole stash of ramen. Very stocked. Bathroom. A beautiful view. Look at that.
Could we also get maybe one coconut?
Yeah.
Are you just visiting? She's gonna be working here.
Where? At the health center? That's so exciting. Where? Oh. Great. Maybe this is pink. I wonder how that works. Island Health Center. I'm on rural family practice, and our nurse gave me fresh vegetables picked from her garden. So this is my first week here on rural family. I love it. Family medicine is so fun because you do a lot of counseling on prevention and treatment and how to manage diseases. A lot of validating listening to feelings. So much variety from mental health to diabetes to post-surgical follow-up, lab results. Got to suture a finger. Someone cut a finger. We use some liquid nitrogen. What else did we do? Stuff like that. We didn't do a lot of physicals, unfortunately, because of COVID, but anyways, I'm in the middle of the forest, and I'm gonna go home, and we're on call this weekend for all the islands in the area, but we're gonna take advantage of this fact, and we're gonna go check out the nearby bay and have a nice dinner. And yeah, I'm really loving family medicine, and the crew is so nice, like the MWA and the doc and the nurses that work there. So anyways, hope you have a good day. It's one of those stands where you can buy your own stuff. Like there's eggs here, right? And then you just put money. You kind of honor system.
The other part is a farm.
Good morning, and we're on a hike in Mount Park. Beach that we spent the afternoon cleaning up. It was pretty big pail of collection today on the beach. Make sure you take away your trash when you go to the beach, especially like if you have like just like used needles like that. That's like super not safe if there's any kids or what the rest of the team picked up. These like giant pieces. I've been told that there's like some stoves abandoned around here as well, and so I'm gonna dump my stuff in. Okay, Ollie, come. Come here. Hi. Hey. Whoa. 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 Hey guys, I'm just going to do some work in the morning out here on our lovely, this is called a patio, before I go into work. Cuttlefish and Disney movie. This is Soul.
You got 4 white ones.
It's so cute.
Hello.
Hello.
Milled the lumber and built my barn. The barn is all my own lumber. The storage is up above. The feeders are here. And when they have their lambs, I'll bring them in, make sure everything's going well. Or if I see them in labor, I try to get them in so that they're confined if there's any issues. Confined, they've had their tails cut off, they've had their ears tagged.
For the tail.
If this gets really hot, put this over the tail. Chunk. I don't know how you do it, Shannon. I honestly don't know how you do it. Because in some degree, you have to stay compassionate, but you still have to detach for your own sanity.
Yeah.
And now, it must be crazy making. Have you seen deer jump fences? They'll be right up to the fence like that, and then all of a sudden it'll be jerk. They've been bringing me the round bales. Now these round bales are much more economical. This whole barn would be filled with 50-pound bales.
Wow.
And that wouldn't be enough to make the whole year. Don't fall.
Won't eat us.
Hay hooks can be dangerous, and you see what could happen if the old lady tripped with the hay hook in her hand.
Oh.
And yeah, how bad it could be. I drove under a hawthorn tree and punctured a cornea. Didn't lose my sight, but I sure could have. I was mowing with a basher. It was pretty new at the farming thing. I thought, well, just one more pass under there. I won't open my eyes. I'm going to write a book on what not to do. I still have 2 bags of my wool.
Oh, those are the wolves.
To be processed. This is the white. You can feel the lanolin on it. You feel a little oily. Loft built here because at one point I was going to have woofers. Have you ever heard of woofers? Or worldwide organization of something. So you can go and work on a farm for how long, and you have a place to sleep, a place to wash up.
This is the, med student setup. Yesterday I was staying up pretty late, probably like till 1:30 a.m. with a friend studying. You can see this crazy mess for an upcoming exam we have coming up. What did I do here? This is the respiratory exam, and I finished off doing a live Q&A for the Waterloo Pre-Med Club this morning, and so now I'm driving off through the forest over to the clinic to do some work. Getting ready to go into the health center. This is my clinic room, my exam room, my table, all our fancy equipment, tongue depressors. This is for looking at skin, so like cancers, looking into the eye, looking into ears. This is my white coat hanging out here. For blood pressure, looking into ears, looking at skin. So I am going to go through our patient charts for the next 3 days and read about their files, what to ask them, read up on any laboratory results, x-rays, whatever, and then take some notes so that we're ready for tomorrow. Hello, it is now 3 p.m. and so I finished reviewing all the patient charts for the next 3 days, which consists of like reading all the latest notes, like, oh, so-and-so is here probably for some lab results, so just like reading about like what's abnormal just so I have an idea, and maybe they're here because they've seen a specialist and there's a note, so just reading all those letters and just kind of getting engaged with like kind of a bit of who they are as a whole story. Done a bit of an assignment, which is like picking a particular interesting patient and writing up their whole story. So I took down a lot of notes, and so I'm gonna go home later tonight and then just kind of like clean it up. I'm starving. It's like 3 p.m. and I haven't eaten lunch yet, so we're gonna go home and do that. Volunteering today at the Main Island Vaccine Clinic. Just finished volunteering, and then I got to chat with these lovely nurses. One of them is a public health nurse, so it was a public health nurse, so it was super interesting to learn about how they develop public health programs basically and do things like assess what the community needs. And another did palliative care, so she recommended a couple books for me to read on palliative care. One of them's called Dear Life. Well, what's the other one called? Anyways, I want to check out about that and just talking about her experience doing palliative care and working when she was working when the AIDS pandemic first started. And I are on a post-work run. Holly, come here. Today was a really busy day at work and we're on call tonight, so a quick run with Ollie down by the beach. Actually my last week here on Main Island on the beach.
Rockfish conservation area, rockfish.
Jam store. They sell jam, chutney, jelly, marmalade, lavender, mustard, vinegar.
Lavender syrup.
Look, it's so cute. We are on a hike. Hello. How do you like Main Island? What's your favorite part of Main Island?
Quiet, it's peaceful.
Yeah.
It's very relaxing.
How would you recommend people enjoy a weekend here?
Put your feet up and do nothing.
Today is the second last day here on Main Island. This was my last official day work and on call. Fingers crossed nothing happens tonight, but you never know. Yeah, really nice to just feel like I've really grown in my here at the medicine. I felt like I wasn't I think it's just like sometimes it's really overwhelming with family medicine to know so much about everything, but yeah, I felt like a little mini resident, just like learning how to do everything from the history of physical to coming up with before my goal was like a week's, but I had when I was in emergency, for example, my last rotation. I wasn't as good as coming up with new management plans, but now really just coming in. This is like just proposing, this is a medication I want to prescribe, and then you're like filling out prescriptions, referral letters, and just doing all that, and even like counseling patients. I feel like I've really grown, and I really say I enjoy family medicine in that like I get to work with the same patients a few times, and they actually know you, and they're like, hey, you took care of me. And even some people are feeling like, or like I felt really warm when I had a patient be really grateful. Like they're like, oh, I felt like you really listened to me and took good care of me, and I think I'll really remember that. Just going the extra step of like printing out resources or educational things for them, I think goes a long way and is something really special to family medicine. And I have to say, the kind of rural life where it's like a smaller community is like really nice in that way to practice in. is Campbell Bay. This is the beach where people come to swim. Hey guys, welcome to the end of this vlog. So in 4th year of medical school, we go all across the province of BC to do different things we call electives, where basically you just try out for 2 weeks or 4 weeks to go to a hospital or a community to get to know the city, to get to know the specialty you're interested in. So I'm hoping to film and make some vlogs next year in 4th year as well. So if you enjoyed getting a glimpse of maybe a community you've never been to, stay tuned, hit that subscribe button, and thank you so much for watching. I really appreciate it.